Good day. Welcome to Spotlight on Putnam Family and Community Services. I'm Eric Gross, your host, along with Diane Russo, the Executive Director of Putnam Family and Community Services, Allison Carroll, the Associate Executive Director, and Cheryl McKeever, the Development Manager. Ladies, good seeing you.
Good to see you, Eric.
Diane, Putnam Family and Community Services, an institution in Putnam County. Tell us how it began so many years ago.
Well, you know, Eric, it's a very interesting story, and it goes back to 1996 when Putnam County government decided to privatize their mental health services. Instead of an outside agency coming in to take over the mental health and chemical dependency services, the staff decided to privatize themselves. So what they did was they recruited a volunteer board of directors, hired an executive director, and on July 1st, 1997, Putnam Family and Community Services was born. And what's so unique about this is that no other county in New York State had privatized their services. So it was really a 50-50 shot that the agency was going to survive, because this was something unique and new. And now this year we're celebrating our 15th year anniversary, and we're very proud of that.
What is the mission statement concerning Putnam Family and Community Services, Diane?
Our mission is really to enhance the potential for people who have mental illness and chemical dependency to recover in a dignified and respected manner so that they can better manage their lives and improve the quality of family and community living.
What about some of the programs that Putnam Family and Community Services offers the public?
We're in a unique position because we do have a dual license of alcohol and substance abuse and mental health. So, and Putnam County being a small county, you need to really be everything for everyone because there really aren't a lot of resources. So we have almost every kind of mental health service available. We have clinics where people can come and get medication or just therapy. We have programs that are for more seriously mentally ill adults where people can come up to 5 days a week, 5 hours a day for intense group and vocational services. We have case management services, which we're now calling care coordination, for people who really need help accessing services, getting benefits, finding housing. So it's not treatment, but it really is assistance and advocacy. We have the chemical dependency services where we provide treatment, and we also have prevention services in a lot of the schools in Putnam County for children to hopefully stop them from becoming addicted or using drugs, alcohol. And then we have lots of advocacy services and family support programs that really do a wonderful job in serving families and children that need services in the county.
Cheryl, how can people find out more about specific services offered by the organization?
Well, our website is a great place to go for more information. At www.pfcsinc.org, we have descriptions on all of our programs. There's contact information for the staff. We have helpful links to other resources on the web, and you can also find out news about the agency. Our press releases are there, and there's an opportunity to sign up for our email newsletters, so everything just comes straight to your inbox. In addition, people can call. Call our main number, and we would be happy to answer any questions that anyone has about a specific program.
You know, Diane, we talk about the need for services in a county like Putnam, a population of about 100,000 people. How many clients were seen by Putnam Family and Community Services last year?
In 2011, our services reached over 7,000 people in Putnam County, and that includes children and adolescents, adults, seniors, and that equates to about 1 in 14 residents in Putnam County, which is quite a lot of people.
People from all ages, young kids, senior citizens, everybody in between.
Absolutely. Families with babies. We have a new program called RISE, which Allison can tell you about, and we just, it just seems that the need these days is much greater for mental health and chemical dependency services. So it's, as funding gets cut, the need gets greater, which really, you know, we were very challenged right now in this time. So, but we do reach many, many people, thousands of people in this county.
Allison, tell us about RISE. What is RISE?
It's actually a screening program for children birth through 18 years old, and we were very lucky to get a 5-year grant from the state, one in only several in the state that were given. and we will go out and screen children free of charge and really assess whether they could possibly develop emotional problems or other issues, because we have realized through research, meaning the government has realized that trauma and issues in children that go untreated really have a more significant impact on mental illness developing later in life. So we're working with schools, with the doctor's offices, with anyone and everyone that we can to offer this service for the children of Putnam County.
You know, of course, when there's a death in the family, as a grandparent, a parent passes away, people right away, the red flags go up. But there are problems, though, especially in this day and age, with young people who just might need that little extra help. Would they fall into this RISE category as well?
Any child, yes. We actually even have programs for relatives as parents as part of our advocacy and family support programs, where there are a lot of parents, grandparents, and other relatives in Putnam who are raising children, and they can actually come and get services and support from our programs. But the RISE program covers any child. You don't have to have a child who has already serious mental illness to benefit from getting screened and from heading off more serious problems in the future.
And you said in the schools in Putnam County, the Mahopac, the Brewster, the Carmel, the Haldane, this local school districts are all part of this program?
We're trying to get them to work with us, yes, to really identify any child who, you know, would maybe be interested, or the parents would be interested, obviously, in having the RISE screening done. So we're hoping that people see it as part of good health care in general, that you bring your child for a checkup when they're born and thereafter yearly more often, and yet we seem to ignore the mental health side of it, which really causes as great a problems as health often. So we're really hoping that will become more normalized.
Cheryl, how are the services funded?
Well, we receive funding from a number of sources. We do receive funding from federal, county, and the state government, but some of our services are not funded that way, and they rely very much on private donations. Family Support and Advocacy and the Relatives as Parents program, like Allison mentioned, those really benefit from contributions from the public. So donations are very much welcome, especially now, as Diane mentioned, as funding is being cut. It's more important than ever.
We also have other funding streams. You know, we accept Medicaid and Medicare, commercial insurance. As Cheryl said, we do have Putnam County funding and state funding. We have grants and contract income, and we do a lot of fundraising. I mean, as a private, not-for-profit, you have to do fundraising.
I want to talk to Cheryl about that in a minute.
Yeah.
But just getting back to the cost, it's the patient's ability to pay.
Yes, that's very important, because we want to provide affordable mental health care and chemical dependency care for people. So we have a sliding fee scale. So if someone comes to us and they don't have insurance and they don't qualify for commercial insurance or Medicaid, we work with them on a sliding fee scale to make sure that we're able to provide affordable care for them.
Funding. Back to some of those fundraising activities. The spelling bee is one of the all-time favorites.
Yes, we have two main activities, and the spelling bee is one of them. We hold that every spring, and it is for grown-ups. It is a team event for adults, and we have a lot of businesses and community organizations that will send a team. That way no one feels singled out, no one has to stand up and feel embarrassed. You sit down as a team and you come up with the word, and the teams come in outfits, they have funny names, they bring cheerleaders. It gets very rowdy, which is a lot of fun, and it really is for a great cause. So that is a wonderful event that takes place every April, and as April approaches, we'll have more information about that on our website. Our other big fundraiser is our dinner dance, which happens in the fall, in November of each year. That is our biggest fundraiser. And at that benefit, we invite all of our friends and supporters to come dine with us, learn more about the agency, and have a good time dancing away the night for a good cause. And that information is also available on our website. So please go to our events page, check it out. We welcome everyone to come and join us.
That's coming up in November, isn't it?
Yes. Yes, our big benefit is coming up in November. Tickets are available now, and sponsorship and advertising opportunities are available as well.
Now, most of these services are provided at the office in Carmel.
Yes, they
at
are.
1808 Route 6, right on Route 6 before you get into the hamlet. Are there any other satellite offices?
Right now, no, we don't have one, but we will be opening up a satellite office in Brewster in Head Start Daycare, because they expressed a need. They have many children there that need services, so we'll be on site. We're hoping by the end of this month. These are for families who can't get out to the agency, so we'll be right on site for them.
And besides in the schools, Are there any other venues where Putnam Family and Community Services reaches out to the public?
Yes. As a matter of fact, one of the services that we provide for the community is a crisis response. So if there's a tragedy in the county, such as a death, whether it's self-inflicted or a murder or a drowning, which we've had in the past several years, we are called and we go out and we provide on-site counseling services to those that are affected by the tragedy. It could be in a school, it could be in a community agency, it could be anywhere, wherever we're called. We also are the crisis response for children in Putnam County. So if during the school day, someone in the school sees that a child is in mental health distress, if the child isn't suicidal or homicidal, they can certainly call us, and we have licensed clinicians that are available to do a mental health status exam to make sure the child doesn't need to be hospitalized. And then we will work with the child and the family to ensure the child's safety.
Allison, what about the any demand for services in Putnam County in this day and age? You know, we have a tough economic situation. People are losing their homes. Foreclosures are going through the roof. That has to impact young people, middle-aged people, senior citizens.
The largest demand by far we've seen in the last year or two has been children. Children and families that come with them, of course, but it's just unbelievable the amount of need now that we're seeing. And we are seeing children 3 years old who are suicidal. And very serious concerns, and it's hard to keep up because the demand is great. So children, families, by far, huge.
How do you treat a kid who's 3 years old, who's suicidal? You know, it seems unbelievable.
First of all, you have to treat the family, because obviously the child is really reflecting what's going on in the family. And so you need to get the family involved. Oftentimes we have to get Child Protective Services involved because something's not right in the family. We do at times have had to hospitalize children, which is always a very sad and hard thing to do. So it's difficult, but it's doable. You can treat. In fact, children are more resilient than adults usually, so it's better to treat them young and to help them so they don't grow up and have more serious problems.
And how is your agency different from other groups, other agencies in the county?
I would like to believe it's because our philosophy, and that's my passion, our philosophy is one that recovery is possible. All too often in this field, and up until more recently, people really believed, especially those with serious mental illness, would not recover. That it was just, oh, you have schizophrenia, you're never going to work, you're never going to have a job, you're never going to have a relationship. And the agency was founded on the belief that recovery is possible. There's been research to show that people do recover. Even if they always have the diagnosis, they can have a life despite that. Just like if you have diabetes, you don't stop living. You do your work and you learn to live with the symptoms and do whatever you need to do. So this agency was founded on that principle, and I think what makes us somewhat different is our application of it and how we really apply that in the treatment and the services we provide.
Shell, given all the good work PFCS does in this community, how can the community give back?
Well, as I mentioned, donations are critically important. But besides that, we also look for volunteers. Several times a year we do mailings to the community, and we always need help with that. And at the spelling bee that we talked about, we need judges to help with that as well. And again, information, if people want to contact us and volunteer, they can go to our website and give us a call.
What's the whole philosophy of PFCS and this message, this recovery message? How did you guys come up with that? And just tell our viewers something more about that.
That's really Allison's area of expertise, so I'm going to hand it over to Allison.
This is something that I was actually trained in back in the early 90s from in Westchester County, but again it arose out of actually Boston University really got this going. But people in the actual mental health setting, the actual clients themselves, really started taking a stance and advocating for themselves, and that along with the research made us realize that again, people can and do recover. They can be active partners in their treatment. So when the agency privatized back in 98, 97, it was again founded on that belief. And so it's in everything you do, from when you walk in the front door, and what is the ambience, and how are you treated by the receptionist, and what is the signage, to every decision that we make, that people are truly partners in their treatment with us. We don't kick people out of treatment because they don't agree with us. Our admissions and our discharges are inclusive rather than exclusive. We don't stop people at the door and say, no, you know, you're too difficult for us. We want to welcome everyone to come in and to work with us. One of my favorite stories is a client who came in with really a a rough referral that he was going to be a very tough, difficult person. And very early on in the intake, I asked him, "What are your dreams?" And he started to cry. Big tough guy started to cry, and he said, "Can I give you a hug?" And I asked him, "Well, let me know why." And he said, "Because no one in my whole history of being in the mental health system has ever asked me what my dreams are." And I let him hug me for that. So it's very important to really understand it's very individualized if you do it right, and that each person is individual. They're not a schizophrenic, they're a person with schizophrenia. And so to really treat each person individually and to make them a part of treatment, to respect their judgment and their dignity, and that is done through every phase of treatment. And it's hard. It's much harder than the way many of us were trained, where we made all the decisions for people.
I think what's important is that the entire staff is trained in this philosophy, from the receptionist all the way up to the executive director. Everybody has to buy in to the philosophy, and we do have, one of our values is a professionalism. We have licensed psychiatrists and social workers, nurses, addiction specialists, care coordinators, peer specialists, and family advocates. So we have over 20 programs, and every person is trained in the recovery-based philosophy. You have to believe it, and we walk the walk and talk the talk, and people get better. We see it every single day. And I tell the staff, you know, when you're having a bad day, and everybody has bad days, just walk through the waiting room. See all the people that are there. Look at them, because we're helping them have productive lives. They have quality lives now. They can, you know, have a job and have a family and have a life, have a relationships, have their children back in their lives. And it's amazing, you know, but you have to believe it. And we truly believe in that philosophy, and it works.
Did you think way back when, 14 years ago, that Putnam Family and Community Services would be the success it is today?
Yes, absolutely. I really do. I believe that, and that's why I joined the agency, because I knew that people truly believed in the recovery philosophy, that, and in my work in the past, you know, we saw people get better. And to bring that philosophy to Putnam County, it was just